Welcome to the lecture on evaluation and assessment. And we're going to look at evaluation and assessment as it pertains to substance abuse and chemical dependency. There are some specific terms that we need to distinguish right up front. And oftentimes when people talk about assessment, they just kind of talk about everything in one. But really, the assessment and evaluation process is stepwise, and there are different levels to the entire evaluation process. So the first term we really need to be aware of is that of detection. And detection is the functionally equivalent to identification and serves as a first level screening purpose. It can tell us about the presence or the absence of disease. Keep in mind that detection is not a diagnosis. It is simply saying we have some suspicion that there is something going on related to substance abuse. We need to determine if this is true or not. So what we're simply looking for is a confirmation, yes, that there is something, or no, that there is not anything. The next term we need to be aware of is that of assessment. Now, an assessment allows the client to be ranked along a particular continuum. It is based on the medical model. The illness may be assessed as either mild, moderate, or severe in intensity, or it may be assessed as being early, middle, or late in its progression. And what the assessment does is it permits some treatment-related discussion to take place. Assessment is more complex than detection. Assessment really involves looking at and obtaining some type of breadth of understanding of what is going on with the individual. And unlike screening and diagnosis, which is primarily a yes or no task, assessments tell you where a client stands along a number of important dimensions. And we look at this, it's important to know once a client is assessed if that client has a mild substance abuse, a moderate substance abuse, or severe substance abuse, and to know where the client is. Is it an early stage, a middle stage, or a late stage? Because this down plays into planning and what kind of treatment protocol that may be discussed for the individual. The next term along this continuum in assessment is that of diagnosis. And diagnosis is defined by both quantitative and qualitative statements based on the correct application of appropriate scientific methods for establishing the cause and nature of the disorder by evaluating its history, presenting signs and symptoms, using laboratory data and other special tests. And if we think about the basic definition of diagnosis, simply what it means is to know the difference, to discern. And with diagnosis, this is the actual confirmation that yes, there is a disorder, and in this case we will say alcoholism. And what diagnoses also say is that this alcoholism is at a certain stage. Let's say, for example, it is severe, and that it is also in a particular stage. And again, for example, we will say it's in the late stage. So that's an actual diagnosis. And keep in mind, when we think about diagnosis, again, this is a part of the medical model. And in order for an individual to receive treatment for alcoholism, drug abuse, or any other chemical dependency, the person must have a diagnosis. You cannot receive treatment without a diagnosis. The medical model said there is a disease, here's a protocol or an intervention plan for it. So the diagnosis is saying yes, the disease is there, yes, it is at a particular level, and yes, it is at a particular stage. And those are the three terms we must be familiar with when we talk about the evaluation process. We must be able to do detection, we must be able to do an assessment, and we must be able to come up with a diagnosis. Yeah. So what should a diagnosis do? Well, first of all, a diagnosis should lead to a clearer understanding of the etiology or the cause or the origin, the development, the expression, and the purpose of the alcoholism. Secondly, a diagnosis should formulate adequate and appropriate treatment plans and programs. Third, diagnosis should provide some notion of prognosis. It should tell us something. Once we have this diagnosis, it should tell us something about what the outcome or expected outcome would be. Think back to the example. If we said we have a diagnosis of alcoholism and that diagnosis is severe and that the individual is in the late stage of the disease, then based on those factors, we can come up with some type of notion of a prognosis. And fourthly, the diagnosis should provide full appraisal of efficacy and outcome of treatments. So now that we know that this person who's been diagnosed with alcoholism is at a severe level and at the late stage, that will tell us something about what the treatment should be and what the expected outcome should be for that individual. Keep in mind that we must also consider for individual variation within the treatment plan. We must also consider for relapses that may occur along this treatment continuum, and we must also think about how the individual will respond to the treatment protocol. Now, we also use what we call screening for alcohol use. And screening is concerned with the consumption questions that focus on frequency, quantity, and binge drinking as the initial screening questions in a clinical setting. And keep in mind what a screening does is it is really the detection phase. And this is the simple binary yes or no. So when we're doing detection, we're basically doing a screening. Yes, there is something there. No, there is not anything there. Also, screenings usually ask a single question about consumption, and that question can lead to additional questions which are more extensive. And here's a sample question of what a screening question will look like. When was the last time you had more than 4 drinks for women or 5 drinks for men? Now, screening for alcohol dependence. There are several excellent tools out there, and these screening tools can be used by anyone. They can be used by the rehabilitation counselor, they can be used by social workers, they can be used by mental health workers, because keep in mind a screening is not a diagnosis. So this is you're just simply trying to confirm or rule out a suspicion or a question you have about the presence or absence of a particular behavior, in this case substance abuse. One example of a screening device or screening tool is the CAGE. That's CAGE. And the CAGE has a very simple scoring. And if an individual answers yes to 1 or 2 of the questions within the CAGE, then that person has some confirmation that there is a problem. So 2 correct answers out of the 4 questions on the CAGE tells the individual practitioner using that instrument that yes, there is something there and there is a need for referral for additional assessment and evaluation in order to confirm and get a diagnosis. In addition to the 4 questions that appear on the CAGE, the practitioner or the rehab counselor can ask additional questions. And also, the 2 positive responses on the cage can result in the practitioner referring the client or the individual for a more in-depth analysis or directly to treatment to see a treatment specialist. Now, one thing that the cage has not been effective in is it has not been an effective instrument in assessing African American populations or Mexican American populations. The other problem or disadvantage with the cage is that it does not assess current problems. It does not assess levels of alcohol, assumptions, or binge drinking at the moment. The questions on the cage are stated in the past, after the behavior, not the current behavior. So here are the 4 questions on the cage, and each letter within the cage stands for a particular point for each question. So the C, the question for that is, have you ever felt the need to cut down on your drinking? So the key in the C is cut down. The A stands for, have you ever felt annoyed by someone criticizing your drinking? The A stands for annoyed. G, have you ever felt bad or guilty about your drinking? Here, the G refers to guilty. And the E asks the question, have you ever had a drink first thing in the morning to steady your nerves and get rid of a hangover? The first thing in the morning here means, have you used it for an eye opener? The E stands for eye opener. So those are the 4 questions, and if an individual answers yes to 2 of these questions, that is sufficient to say yes, there is a problem and the individual needs to be referred to the next step. Now, before we talk more about the next one, which is the tweak, it is important to understand again that this cage is simply a screening test, and you cannot use it for a diagnosis. You can only use it as a confirmation that yes, something exists, we don't know at what level, therefore the person must be referred to the next level. So it confirms a suspicion or rules out a suspicion. The next screening device that can be used is the tweak, and the tweak stands for the Michigan Alcohol, the tweak is a test that was developed as sort of a spin-off from the cage. And the tweak is a 5-item scale. And we will in a moment define what the tweak stands for. But this particular test was developed to be used with pregnant women. And basically, it took some of the same questions from the cage, but it substituted a question on tolerance for a question on guilt. It modified the question on annoyed and added a question about amnesia. This test, one big advantage was that it proved to be more sensitive with inner city African American women, unlike the cage, which did not have good test reliability or validity with the African American population. Now, here is what tweak stands for. The T asks the question, how many drinks can you hold? 3 or more suggests tolerance. Okay. So the T here stands for tolerance. The W asks, has anyone worried or complained about your drinking in the past year? The W stands for worried. E asks the question, do you sometimes take a drink in the morning when you first get up? The E stands for eye opener. The A asks, has anyone ever told you about things you did or things you said while you were drinking that you could not remember? The A stands for amnesia. And the K asks the question, do you sometimes feel the need to cut down on your drinking? And the K here is used in reference to C in cut down. So those are the questions asked by the tweak. Now, also, the tweak, if an individual get a score of 3 or more with a positive response, then it confirms dependence. And again, the person can be referred to the next level for additional assessment and treatment planning. Now, there are some screening options that you can give using the tweak, using the cage, and also using another one that we will talk about in a moment, the audit or the mask. You can give a screening test in 4 different ways. One is a face-to-face interview by a non-clinical interviewer, and that non-clinical interviewer can be any human service worker. It could be a school counselor, it can be teachers, so it can be anyone who does not necessarily have the background in a clinical setting. You can also use a screening in a face-to-face interview by a clinician, someone who's been specifically trained in substance abuse, in the medical side, or in clinical social work, in certified rehabilitation counselor with an emphasis in substance abuse, can use this. It can also be administered paper and pencil questionnaire format. And given that we are now in the technological age, it can also be used in a self-guided computer interview where the client is simply responding to these questions on the computer and it moves them through the step-by-step process to respond. Now, here's another example of a screening test called the MASK. And the MASK stands for the Michigan Alcohol Screening Test. The MASK is one of the most widely used screening tools. It contains 25 items, and these items are yes, no responses. And the MASK 25 item questions were in the original. There have been some shorter versions developed since, but the original contained 25 yes or no questions. The MASK was designed for use either within a structured interview or for self-administration. The questions in the MASK touch on medical, interpersonal, and legal problems resulting from alcohol use. One big advantage of the MASK is that the reliability and the validity have been established across use with multiple populations, and the additional forms of the MASK that have been developed is the MASK Brief, and the MASK Brief has 10 questions or 10 items, and there is also the Short MASK or the S MASK, which contains 13 questions. And with 2 exceptions on both the Short MASK and the Brief MASK, the positive responses are scored. And each question is assigned either 0 points, 1 point, 2 points, or 5 points. And the scoring on the original 25 question mask, if an individual got a score of 5 or more points, it indicates alcohol dependence, and 4 points is suggestive of alcohol dependence. Now, it is important to note that what we're really looking for are those negative responses when we use the mask. An additional screening instrument that is used is the audit. And the audit stands for the Alcohol Use Disorder Identification Test. Now, the audit was developed through the efforts of the World Health Organization, and the goal of the World Health Organization in developing the audit was to create a screening tool that would meet several criteria. The first criteria was to identify those with high risk alcohol use whose drinking warrant closer examination, not simply people who were alcohol dependent. The second criteria of the audit was to be effective in different cultures, and that included cultures in both developing and developed countries. The third criteria was to be suitable for use by an array of health care workers. The fourth criterion of the audit was to be tested in a variety of populations, and that it has been. The fifth criterion of the audit was to be brief, and that can be answered in a short period of time. Keep in mind, one positive about this test is that it is the most widely accepted screening instrument. Whereas the mask is the most widely used, this one, the audit, is the most accepted because it has the cultural validity built into it, and it has been tested and validated across numerous and multiple cultures and populations. The audit is organized into 3 basic domains. The first 3 questions of the audit focus on hazardous alcohol use. Questions 4 through 6 focus on the symptoms of dependence, and the last 4 questions focus on harm resulting from alcohol use. The total score that an individual can receive on the audit is from 0 to 40. And the scores are organized into 4 zones, with each one of the zones suggesting what the clinical response should be. Let's take a look at those zones, the points assigned to them, and then the clinical response. In zone 1, if an individual scores between 0 and 7 points, the recommended clinical response or intervention is alcohol education. If the individual is in zone 2, that means the person scores someplace between 8 and 15 points, and the clinical intervention is simple advice. Zone 3, the individual scored between 16 and 19 points. The recommended response would be simple advice in addition to brief counseling and continued monitoring. And if the individual scored in zone 4, which is 20 to 14 points, the recommendation or response is referral to a specialist for diagnostic evaluation and treatment. Now, all of these that we just reviewed, the audit, the mask, the tweak, and the cage, are screening devices. And they all must have a score of at a certain level and a positive score. And if there is a positive score, then the question becomes, what happens when screening is positive? Well, there are several things that the practitioner or the counselor must be prepared to do. First of all, after you do the screening, you score the screening, you share the results of the test and discuss them with the client. And keep in mind when you're doing this discussion that you are not telling the client that they are diagnosed with any kind of problem or dependence or substance abuse, but what you're actually saying to them is you answered yes to question 1, 2, or whatever, and based on those responses, there is some concern about the presence of the amount of alcohol you're using. There's some concern about the behavior, and this warrants some type of referral to the next level. Also, what you will do with that information that is a positive scoring in the screening is you take an alcohol drug history for treatment planning. You have to get some of this basic information from the individual, even though there is not yet a true diagnosis, but you will ask certain questions and take in some drug or alcohol history that can be used later when a treatment plan is developed. And when you're doing this, among the first priorities is the identification of any medical issues related to drinking. Yeah. So, what is crucial also in this process is identifying situations requiring medical attention, because those positive clues in a screening tell you you must get more information and you must get that medical information. And there are some general health status questions that you can ask during the screening process. Here are those questions you should consider. The first question you would ask the client or the individual is, have you been seeing a doctor recently or thought that you should have seen one? The second question is, when was the last time you were seen by a physician? The third question, have you ever been hospitalized? If so, for what? And the fourth question you would ask is, do you have a history of accidents or injuries? Or have you been in any fights that required medical attention? Did any of these occur while drinking or using drugs? These are key questions, and if you look at these questions, you can see there is a sequence that each question is the next higher level of information. Basically, the first question is simply saying, have you seen a doctor recently? I thought you needed to see one. When's the last time you saw a doctor? When was the last time you were hospitalized and under what conditions? And is there a history of accidents or injuries? Because again, if there is that history of accidents or injuries, or if the person engages in aggressive behavior resulting in fights that result in injuries, it's telling you that the behavior is escalating. So it's important when you're doing the screening and you have gotten a positive score on any one of those screening instruments you've used, that you ask these general health questions. Also, as a part of this general health status, you can assess what's going on with the individual physically, because the individual may also present some risk for withdrawal. So you have to actually assess the potential risk for withdrawal. And you are going to ask some of these questions maybe within a particular time frame, because what you really want to find out is what this individual's drinking or drugging has looked like in the past week. You want to know about the levels of tolerance. You want to know about how much time elapsed since the last time the individual used alcohol and the current physical status. You may want to try to get some information on the prior experience of what the individual did to decrease or to stop drinking or drugging. What are some of the current or past medical problems, including allergies that the person may have? So you can ask some very detailed, some more specific questions that will give you some idea if this person is at risk for withdrawal. Also, an individual can be in your office while you're doing this assessment and asking these questions and may be in a medical emergency. The thing to remember, typically when an individual is going through withdrawal or if they are presenting severe signs of substance abuse, is that many medical emergencies will be clearly recognizable. And in these situations, you certainly will use emergency transportation, you will use the police, you will use rescue squads. This is particularly important because the client may actually need life support. Now, when we talk about immediate medical evaluation, the following are some indications that immediate medical attention and evaluation may need to happen, but it may not be life-threatening. However, you still have to be prepared to respond with prompt medical attention and should be ready to arrange some type of adequate evaluation. And some of the serious problems that could occur that will require immediate medical evaluation and may not be life-threatening, but they still require immediate attention, would be the recent substance intake at levels that risk developing toxicity, poisoning, or organ damage if the client is asymptomatic. Another implication of immediate medical evaluation is the intake or ingestion of unknown quantities and substances. The individual may also be exhibiting some hallucinations with marked paranoia. There could be confusion or delirium. The individual could have severe agitation and remain showing some of these signs of agitation even after the counselor has tried to calm the person, but they remain agitated. There may be severe tremors. The person may have tachycardia, and that's the heart rate, remember, at 110 beats per minute. The individual could show fever. There could be a history or evidence of trauma, especially head trauma, and this is very common in individuals who are chronic substance abusers because the head trauma usually results as a fall or some balance problem. So typically the individual will be exhibiting some history of trauma, and the client may also be in a semi-conscious state, and this is marked by the individual being aroused briefly but falls asleep when the stimulus is removed. And again, keep in mind, these are not necessarily life-threatening, but they're serious. And if an individual is presenting with these problems, there is the need for immediate medical evaluation. And that medical evaluation will determine the next step, if this individual needs to be hospitalized, and in what type of setting this individual would need to be hospitalized. Also, there are some serious risks that the individual may present for withdrawal. And for individuals who have recently stopped drinking or have reduced their consumption significantly or intend to, here are some suggestions of significant risks for serious withdrawal. The first one being consuming more than the equivalent of 12 drinks per day for more than 2 weeks. A second one is a history of a difficult withdrawal. Thirdly, the individual may have seizures or a history of seizures. And fourthly, the individual has dependence on multiple substances. Again, these are risk factors for serious withdrawal. There are also situations that, while not medical emergency, still warrant a medical checkup. These include all clients with heavy, extended alcohol or drug use who have not had a recent medical exam, anyone reporting a history of bleeding, and those who have a history of chronic medical illness such as high blood pressure, who are not under a doctor's care. Now, the purpose, let's kind of summarize some of the key points that we have identified in evaluation and screening. So the purpose of evaluation in the clinical practice, well, screening. Why do we do screening? What's the purpose of screening? How does screening differ from diagnosis and assessment? Keeping in mind that we talked earlier about how this is a progression along a continuum. Also, as a part of screening, something that we must consider is we must look at what is the individual's motivation level, because that may influence how the person responds. So motivation can include, well, reasons for drinking. Why is it that a person is drinking? And those are going to be very different and very individualized from person to person. But motivation is a big part of the process of assessment. Also, a part of motivation, we may want to ask or somehow get a feel of the individual's readiness for change. You know, the person is here in the office, but are they ready now to proceed to the next step after we've done the screening and we've said, yes, there is some concern, yes, there is some positive statement that there is a problem and you need to go to the next step. So motivation really looks at two areas when we're dealing with this population. It looks at the reasons for drinking, and it also looks at the individual's readiness for change. The treatment planning, and again, treatment is an individualized process. And in order to do treatment planning, you have to know something about the client. How do you get to know something about the client? Well, we must do some kind of assessment. And when we do the assessment, we get a diagnosis, then we can formulate a treatment plan that is specific to that individual's need. And keep in mind that the treatment plan is individualized. There is not a one-size-fits-all treatment plan. It is not filling the blank kind of treatment plan. One person may have a need with family issues, whereas another person will not. But we have to take this information based on that individual to develop that plan. Also, follow-up is a big part of evaluation. And follow-up is important because it not only tells us if the person is maintaining, but it also identifies other areas in which the person may need additional intervention or additional treatment. Follow-up also tells us that maybe now the goals are different than what was in the treatment plan. We may need to make some change because there are some other dimensions such as self-esteem, employment, spirituality, relationship stability that now needs to be addressed as well. It's not just the intervention related to the substance abuse. So when we talk about ways to do assessment, ways to do an evaluation, the important things we need to remember is that assessment is an ongoing process. Evaluation have multiple stages. Once we have a diagnosis, once we've done a treatment plan, that's only part of it. It continues. Evaluation continues because we need to know later during the follow-up phase what is going on, what needs to be changed, and if this is indeed working. So basically, when we think about putting everything together in the evaluation process, and we need to kind of consider what it is we need to do for the screening, what we need to do for assessment, what we need to do for diagnosis. We need to consider motivation, treatment plan, and follow-up. And as we summarize these different areas, what we really need to say is that screening, for example, may be less relevant in treatment settings where people come through the door asking for help with alcohol problems. It is most important in contexts where large numbers of people are seen, some of whom have alcohol problems, and most of whom are not asking for help in regard to their drinking. Diagnosis, on the other hand, in the limited sense that we've talked about it here, is important in settings where determination of a formal diagnosis is required for institutional or reimbursement purposes. Keep in mind, if we don't have a diagnosis, insurance companies will not pay. Assessment is the broad task of understanding the individual's unique situation, likely an important task in most clinical settings. Motivation for change is a more significant problem in some settings than in others. Treatment planning is important unless the same services are offered to all individuals regardless of their characteristic, and that is really not what we're looking for because treatment plans need to be individual. And finally, follow-up is a key part of any type of evaluation and can promote long-term quality of client care. So follow-up is not necessarily just the end. Follow-up is key because it dictates the next step, and any effective treatment plan must include follow-up. So these are key things to remember when we talk about the process of evaluation and assessment.